clerk should be ready, sir.
Thank you. I see that we're now live. Good afternoon. I'm Jonathan Steinberg, State Representative from the 136th District and co-chair of the Public Health Committee. We are convening a meeting of the committee today to consider JFing a specific piece of legislation. There may be those of you who expected us today to be in what will be described as hybrid mode and not totally virtual Zoom mode. That had been our original intention, but we had to afford all the staff the opportunity to get trained up on what hybrid means. Having gone through the hybrid training myself, I can reassure you that it is not all that different than the way we operate, and that starting next week, when we do have committee meetings, we will be meeting in hybrid format, which we will discuss more. However, public hearings will remain Zoom only as per rules of agreement. The hybrid format affords us the opportunity to be in one of the rooms and to see one another and to mask it as we so choose, and yet still affords the opportunity for those who are not comfortable to continue to participate via Zoom. So that was the intent for today. We apologize for any confusion on that part, but it was just difficult to make sure that everybody was on the same page to conclude this week. Are there any questions on that before we proceed to the matter at hand? If not, I will welcome my co-chair, Senator Anwar. Do you have any comments at this moment?
Thank you, Mr. Chair. No comments, just moving forward with our business in front of us. Thank you again for everyone for joining us.
Good afternoon, Representative Pettit. Anything you'd like to share?
Thank you, Mr. Chairman. I believe our caucus just has one amendment to offer that the other ranking member, Senator Summers, will offer, and members may want to make a brief statement about the bill we're voting on today. Going back to the meeting, so I assume that means that essentially, if people are long distances away, people will be able to attend meetings and public hearings by Zoom, but for the meetings, if it makes more sense to them, they can attend those in person.
That's precisely correct, Representative. You know, we've long looked forward to the day where we can see each other and hang with each other and debate each other face to face. We've finally reached that juncture where we think that we're doing so safely. As I said, there may be those who chose to show up. Thank you, Henry. Who show up in person, but prefer to continue to wear a mask, and we're going to respect that as well. So we're going to see how it works out. We do believe that the rules and the efforts by those in the technology area are such that it should be pretty smooth. We've been very blessed that our staff has become very adept at dealing whatever is thrown at them, and will be able to help us adjust to the hybrid concept. Thank you, Senator Summers. Any questions, comments?
Yes, good afternoon. I think we're ready to get going, and I'm just excited that we will be able to meet in person very soon, and to have our people that are following these public health bills have a different way in which they can see us. Thank you.
Thank you. Senator Wong, good afternoon.
Good afternoon. Happy Friday. And today we're going to vote on one bill. Am I correct? Senate Bill 88, an act concerning aid in dying for terminally ill patients. It's one where I have incredible challenges with, because we heard some incredible testimony, emotional, heart-wrenching, and it reminds me of the thoughts I had when my father passed in the ICU, and the thoughts that I wanted to be able to comfort him. But it is also important because we've had incredible outpouring of emails, written testimony. But I just want to reiterate, as I said in the hearing before, it's not a right or wrong vote. It's really a vote that we have to cast as legislators, which is always difficult and maybe challenging, but it's represented on the values and the thoughts and the testimony that we've gotten. So I wanted to be able to share that as we begin this process. We're going to vote on one bill, and it's been an emotional roller coaster process. And I want to acknowledge all the people who made the efforts to give their voices to be heard. And I want to applaud my fellow committee members for their consideration and respect as we went through this whole process. So thank you, Mr. Chair.
Thank you, Senator, for those sentiments. And I would like to express on behalf of both we chairs how much we appreciate your forbearance and patience in bringing this bill forward again. We know that the hearings are really difficult to listen to. Just listening to the stories, I'm sure, has an effect on all of us. We are talking about this bill to some degree because we did pass it out of committee last year on a bipartisan basis. And we believe that given consumer sentiment in the state of Connecticut, that it's appropriate for us to consider it again this year. But we by no means minimize the concerns that have been expressed for the exhaustion with relation to this bill that is natural given the fact that we've taken it up many times and it's a very emotional subject in and of itself. So we appreciate again your consideration as we debate this bill going forward. Before I get into the specifics, I just want to say that even with the JFS language that we'll introduce and vote on today, this bill is fundamentally the same bill we've run in the past. If anything, it is more rigorous than when we ran last year, going back more to the 2020 hurdles, if you will, that we're asking people to jump through. We do it with some conflictedness in that by making it even more rigorous, it means that fewer people will be able to avail themselves of it if they're indeed eligible. But it's a choice we've made trying to be responsive to many of the concerns we've heard expressed by committee members and members of the public. So without further ado, I'd like a motion to consider the JFS language, which would be LCO number 2657.
So moved.
Second.
Moved and seconded.
Like a one block
Second.
area around the lake.
I'm sorry, I missed that. Was that actually for us?
No, it's
Oh.
just seconding.
All right. Sometimes it's hard to follow with all the extraneous chatter. Let me just very quickly review. Most of the changes from the JF to the JFS language are really related to clarifying language. We removed a section that we didn't think was beneficial to the clarity on some of the legal points, but the bill has not changed in any dramatic fashion. We believe that this bill, with these changes, is ready for a vote by the committee and will be effectively what will be heard on the floor of the Senate should the Senate take up this bill on the floor. Are there questions with regard to or comments with regard to the language that is before us? If not, if we're ready for a vote, I'll ask it. Do we need to do a roll call vote? Would anybody object to a voice vote, or we'd like to do a roll call vote? There we go.
We have to do a roll call vote, Mr. Chair.
I just thought I'd ask. Okay. Representative Carpino, you raised your hand and took it down. Was there something else you chose to say?
You clarified the procedure. Thank you, sir.
Thank you. And I believe Senator Summers also briefly raised her hand. Was there anything else you wanted to add? Where did she go?
Yes,
Okay.
I would like to offer an amendment subject to LCO technical and conforming changes on this particular JFS language. And this amendment would basically be adding back in section 16, which was deleted, which states that any person who knowingly possesses, sells, or delivers medication dispensed or prescribed for aid in dying for any purposes other than delivering such medication to a qualified patient or returning such medication in accordance with section 11 of the act shall be guilty of a Class D felony, and that nothing in the other sections inclusive of this act shall preclude criminal prosecution under any provision of the law for conduct that is inconsistent. And I move this because I think it's very important if this bill passes as an added measure of safety. We are talking about people that could be in possession of medications that are off-label from the FDA. They are intended for a patient to use, to take as a cocktail to terminate their life. And if someone is using these medications in another way, they are out available that can, again, kill you. And therefore, this is an added measure of safety that should absolutely be in this bill. We are talking about drugs that are deadly, and if used improperly, could not only kill somebody who is not on the end of their life, but could cause severe and unchangeable consequences should someone take them improperly. So I think that this is critical to have in this bill, should this bill move forward.
Thank you, Senator. I'll respond, and then we can have other questions. In reviewing the bills.
I think we need a second.
Oh, we do need a second. To your point,
Second.
Senator. Give a second.
I can second.
Okay.
We have a motion and a second. The amendment is on the floor and open for conversation.
Yeah, Mr. Chair,
Yes,
it's
Representative.
more of a procedural question.
sure.
Leave the motion to adopt the bill was made and seconded. Do we not have to vote on that and then do the amendment? Or can we do the amendment with the JFS language that you talked about?
Very good question, Representative. And I should know the rules, but I will yield to our LCOs on this.
The motion to amend is to amend the JFS language itself, so you can vote on the amendment first.
Does that answer your question, Representative Betts?
Yes, thank you very much.
I'm glad you checked in though, because I wasn't 100% sure myself. All right, I'm going to comment briefly and I'll recognize Representative Pettit. This was language that we considered, and in reviewing the totality of the bill, decided that the other protections that were currently in state statute and that we had in the bill were sufficient to protect, and looking at actual outcomes in other states, felt that that section was not necessary. My understanding is that the bill holds up and achieves its objective and has adequate protections as the JFS language is written. And I would not support reinsertion of section 16 because we've put in a lot of work to determine that we don't feel that that's something we feel is necessary for the progress of the bill. Representative Pettit.
Thank you, Mr. Chairman. I think the language is necessary for safety, as Senator Summers has mentioned, and I think for those listening, I think the inside baseball, it obviously goes to the point of referring this outside of a public health committee to a legal committee such as judiciary or general law. And I have concerns not only with that section, but with other sections in terms of death certificate, life insurance, and other forms of insurance proceeds, the people involved in the process. There's been discussion about the licensed clinical social workers. There's not particular mention of APRNs or PAs, so the language is not limited to. So I have a number of legal concerns that are outside of my area of expertise and feel it needs to have reviewed by another committee. So for the multiple reasons, including the one enumerated by Senator Summers, I support this amendment and urge my colleagues to vote for it. Thank you, Mr. Chairman.
Thank you, Representative. You brought up a number of issues which we have discussed in previous years, and we've had ample opportunity this year and in past years, if there were issues with other sections in terms of the protections they afford, to address them. Again, this bill to a large degree conforms with bills that have run in other states, obviously with some changes to conform to Connecticut law and statute. Again, these are all issues we've talked about in the past. The bill, as written, we believe meets the need in Connecticut law. And given the history now, which expands year after year in other states, we believe that the other states' experience gives us reason to be confident that the legal restrictions we put in this bill are adequate and appropriate.
Thank you,
I'm
Mr.
sorry.
Chair. I would note, though I'm not, can't say that I'm expert in the area, that I believe Vermont, obviously in our region of the country, I think has run this through their judiciary, and in several states where this bill has gone forward, it went forward on a referendum of the people as through a straightforward legislative process. So I think the state closest to us actually have gone through judiciary, if I'm not mistaken. Thank you, sir.
Right, and I understand your point. Every state is somewhat different in their process. Ultimately, some of the things we're discussing, we're speculating about, and we won't know until a judge rules. And we hope we never have an instance where that's even necessary. Again, we are basing it upon what has typically been passed in other states with a measure of customization for Connecticut law. We think we struck the right balance. Representative Carpino.
Thank you, sir. This is a very personal issue for many, and I respect my colleagues on both sides, but this amendment shouldn't be one that causes any concerns. We're talking about deadly medications. So for anyone at home who's missed our very lengthy hearing last week, I just want to make sure that we understand we're talking about medications that are being prescribed for the sole purpose to end a life and to ensure that there's public safety protections in place are a very consumer-friendly, pro-public health policy that I think is important for this committee, regardless of whether you vote for or against this bill, and that is everybody's individual right. I can't speak more strongly for an amendment than this well-drafted one in front of us. We're talking about keeping medications out of the wrong hands and have in this committee for years, and yet we're intentionally removing with the language before us today a safety provision to keep a better chain of custody and to make sure we know exactly where these deadly medications go. So I speak in strong support and really encourage my colleagues on both sides of the aisle to read the amendment before they cast their final vote. Thank you, sir.
Thank you. Representative Zupkis.
Thank you, Mr. Chair. And I could not have said it better than Dr. Pettit. He actually said the things I was going to talk about. And I am strongly behind this amendment because, as it's been mentioned, we are talking about a deadly medicine. We have had it in the past. It was mentioned about making this bill more rigorous. And in fact, by taking this language out, makes it less rigorous. So I am in strong support of this for all of the reasons that have been mentioned earlier by my colleagues, and it is extremely important. I would never want it to have to go to a judge before it was vetted through the Judiciary Committee, which should happen for most of the bills, especially this bill. It should be going to judiciary before it would ever go to a judge. Thank you.
Thank you, Representative. I didn't mean to intend that we should roll the dice and wait on judges, but I just say we would not know for certain in some cases until it was applied in that fashion. Senator Anwar.
Thank you, Mr. Chair. I just want to share that this bill is somewhat more restrictive than the bills that are in other states. The fact that in this bill we are requiring, instead of 2, we are requiring 4 witnesses. Instead of having oral testimony, we are requiring written testimony with 4 witnesses in this, and having that about 15 days apart. It's far more restrictive, and I think the safety net that we have created in this bill is much more than many of the other states. And that's why I think this amendment is not needed, and I would urge my colleagues to vote against it at this time, because as you've stated, Mr. Chair, we have created that safety net, and the language has been vetted and thought through, and is much better than what it has ever been, and better than many of the other states. Thank you so much.
Thank you. Representative Berger-Javala.
Thank you, Mr. Chair. I was actually going to speak to the restrictions that are actually stricter here than they are elsewhere. So thank you, Senator Anwar. But also I think it's important to point out that deadly medications are already in the homes of nearly every hospice care patient in the state. So we've got to remember this is not something brand new that's happening here. And I think the drugs that are being described in other conversations are already prescribed for patients who are already under the treatment and care of doctors. Thank you.
Thank you, Representative. Representative Terziak.
Thank you very much, Mr. Chair. I'd like to encourage people to vote against this amendment. It's being presented as if it's either we put in this language or nothing can be done. Taking somebody else's medication is a crime. Transporting medication that is not in its original labeled condition is a crime. Stealing anything, including medication, is a crime. I'm content with that amount of enforcement. Ever since we've been doing criminal law reform, every time we turn around, somebody has a good reason and a legitimate reason why one more thing should be a felony. Felonies ruin people's lives. I'm content with them being arrested for stealing, for having a medication that isn't prescribed for them, and for having medication not carried in its original labeled container. I think that's enough. Thank you very much, Mr. Chair.
Thank you, Representative. That was the point I was trying to make. You made it more eloquently. We're looking to existing law, which we believe affords the appropriate protections without this section. Representative Clara Estitria.
Thank you, Mr. Chair. My question, why was this section removed to begin with?
I believe, let me clarify further if I haven't been clear. In a review of the language, we decided that existing law was sufficient to cover the point that we needed to make here. And there were a number of minor changes that just relate to the clarity and the direction of the legislation. As has been stated, we've been as careful as we can be to make sure there are adequate protections. And the bill, as per JS language, recognizes the hard work of many to figure out what's the best way to afford those protections. It was deemed that Section 16 was simply not necessary for us to achieve that objective. I hope that answers your question.
It does. And a follow-up question, Mr. Chair. So if this language was not taken out, would this bill have had to have gone to judiciary?
I'm not an expert on what takes place in screening, to be honest. It certainly might be, but the reason we have a screening process is that those who are involved with that process make those decisions. So I'm not going to speculate on that outcome.
Is there anybody here that can answer that for me?
If you're addressing a question to the LCO, please
Yes.
do so.
That would be a decision for the Senate Screening Committee, whether it gets referred to a judiciary or not.
Sorry, yeah, we are speculating. I wish I had a better answer for you.
All right. Thank you, Mr. Chair.
Representative Betts.
Thank you, Mr. Chairman. I've been thinking about this for a long time, and as you and many others have been doing it, and it strikes me as if there's never going to be a satisfactory law adopted that will be satisfactory to all the people who either are or will be affected by this. With something as significant as what's taking place now, I'm not a lawyer, but I don't see how we can proceed without some kind of judicial response, the legality of what's going on, or whether the amendment that's being proposed should be or should not or cannot be in the bill. And I just don't think it's as solid as it could be. I must say that I've never thought that the government should be in this business of making decisions for family members, because we know it in our family far better than a government law. And it strikes me as being intensely personal, and no law being written or adopted by a legislature is going to change that. But at the very least, I think we should have some kind of legal standing. And I'm wondering, Mr. Chairman, could you tell me who deemed it or how this was taken out of the bill? Because I haven't heard the answer to the question of why it should not go to judiciary. I understand your point about not personally making that decision, but in the overall credibility of the bill, I don't understand the motive or the need for taking this out. Could you ask me or tell me who it was or how it was taken out?
Well, as you're aware, Representative, that's what goes on in the process of screening and in the process of refining a bill is not always part of the public process. All I can say is that as we readied this bill for passage, we gave it a fresh look, looked at all the sections of the bill, and determined whether or not it was as clear and as directed as possible to achieve our objective. And I will say that I take your point, but I disagree with you on one fundamental thing of what you said. You said that government should not be making decisions for people. If anything, we are doing the exact opposite. We are taking government out of the process for people to make their own decisions. What we're trying to avoid is that people, based upon their own beliefs, get to decide for an individual how they choose to go out of life on their own terms. So this is not necessarily government interference or coercion. It is government enabling of a small group of people to take advantage of a very narrow opportunity to end life on their own terms. So I just don't see it as you do, that this is in some way government interference or coercion. I view this as an enabling piece of legislation.
And I respect that, Mr. Chairman, but I wonder if we do it for this, does it not open? It's not a question. I feel like it opens the door for this to be applied to other types of illness or circumstances. And with all due respect, the government, as we know over the last couple of years, has more than taken away the decision-making authority of parents with their kids or with a lot of the unfunded mandates. So that may be the intention, but there is no definite, I couldn't be more committed to the idea government is interfering with my life and my family. And, I would be very upset, frankly. We'll do whatever is best for our family, but not because the government says this is what you must do. So I hope it does.
I don't see anything in here that says the government is telling anybody what they must do.
Okay, I hope it goes to judiciary, and thank you very much.
Thank you, Representative. This committee and other committees frequently have to contemplate the prospect of what is often called the slippery slope. And I've given this speech before. If we give excessive consideration to the slippery slope argument, we can effectively paralyze government because we can never know with any certainty what subsequent legislatures are going to do or what the priorities are going to be at this point in time. I submit that we need to deal with the facts as we know them today and the situation as we know it today, and our intentions to do exactly what is in this bill as per its JFS language. Representative Claire Teacher, for the second time, I'm going to ask you to wait for Representative Cavros DeGraw, who has not had a chance to speak.
Thank you very much. I would say that, what we're talking about here is when we talk about government making decisions for people or not for people, by not acting, we are making a decision for people. We have made decisions for people who wanted to access this care and were unable to. And we have to remember that this is a type of patient care. And we talk a lot about, doctors need to be free for their scope of practice, and they need to be able to have conversations with their patients and give them good advice. And I think that that's part of what we're looking at here. The reality is that across the country, 1 in 5 people are in states that allow this to go to be part of their end of life care. And I think that when we're talking about what the government is and is not saying, we are saying something when we don't pass this. And if the concern really truly is public safety, then perhaps it's not judiciary, but it's public safety that should be looked at with this. But I think that might not be the ultimate goal of the amendment. So thank you so much.
Thank you, Representative. And just to reiterate, it is up to screening to make those determinations. Representative Claire DeSticheri for the second time, followed by Senator Summers.
Thank you, Mr. Chair, for your indulgence second time. I need to go back to that, my question with taking out section 16. I'm under the impression that it's a mandatory referral to judiciary under our joint rules. So I know that's not, you said your decision, but that's my understanding as if that section 16 was in there, it mandatory had to go to judiciary.
Thank you, Representative. I understand that that's your impression.
Thank you, Mr. Chair.
Senator Summers.
Yes, am I unmuted?
We can hear you.
Okay, great. So there's been a lot of back and forth on this amendment, and I can assure you there are other reasons that I think that this bill should be looked at in judiciary that have nothing to do with this. But that's here nor there, that's for screening. I think that when we are passing a bill of this nature that is talking about life and death of patients, that we're going to be putting medications, again, that are off-label, that are not intended for this purpose, in high doses that are deadly, we absolutely have to include this language as an added measure of safety. We've done that before when we passed opiate bills. We have stuff right in there talking about if you are in possession, blah, 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 and you do this, it is a felony. These are things that have been done before. So I can't understand why, if this bill is so important, which it is to so many, why we're not putting that in there as an added measure of safety. And I would encourage everyone who is watching this today or is going to vote in support of this. If you vote in support of this amendment, you can still vote in support of the bill and it can still pass out of committee. I do not understand why we are not adding this as a safety measure, which is really critical to provide assurance that these drugs, God forbid, if they get into the wrong hands or are used in the wrong way, that people are held appropriately accountable. So I think that we have heard a lot about that this language is tighter than other states. We're adding more witnesses, for example. That's irrelevant to what this particular section does. If we truly are trying to be a little bit more diligent than other states in providing stopgap measures and safety measures, we absolutely should have this in there. And I feel very strongly, regardless of how you feel about the bill itself, that not putting this in there makes the safety aspects of this shallow, to say the least. And I encourage everyone to support this amendment, which was in the original bill. Thank you.
Thank you, Senator. In response, I'll just say that I respect your point of view, and I feel probably equally strongly that this amendment is not necessary, that the protections that are in there upon review are both adequate and appropriate, and that I strongly encourage all members of the committee to vote down the amendment so we can get to the JFS language. These kind of things can be debated on the floor, but at this point, we're very confident the bill offers appropriate protections for the people of the state of Connecticut, and more importantly, really for the limited group of people, both providers and those who would take advantage of it. And I'm highly confident the bill holds up as it is and does not require any further protections in that regard. Are there any other questions or comments, or can we move on to have a vote on the amendment?
Mr. Chair.
I'm sorry, I didn't see you, Representative Duffner. Did you?
I'm sorry. Yes, I can't put my hand up for some reason. I wanted to speak, but I just wanted to say a couple of things about this amendment. This amendment does absolutely nothing to take away from the end outcome of this bill, which is to allow people to make those choices. It does nothing to change that. What it does is provide safeguards, as Senator Summers said. In particular, we're putting a lot of time and effort into our mental health crisis right now. We're talking about increased suicides, not only nationwide, but in our state. And having access or no provisions around to safeguard this concoction of medication that could take one's life is just, in my opinion, very, very wrong and irresponsible. So I urge everybody to support this amendment. It does nothing to change the outcome for individuals to be able to make this choice. Nothing. Thank you.
Thank you, Representative. And I would invite you to read the bill throughout. And I think that you should be satisfied that we have done everything within our power, along with the lines of what other states have done, to make sure this is not used for suicide. There are many, many sections that I could cite that relate to protections against the prospect of anybody using this for suicide. They have been fundamental parts of this bill from the very beginning. I hope we're not going to go down the path of calling this suicide. We've had these conversations before. I take your point, but again, the chairs feel really strongly that upon review of this bill, the JFS language as proposed without the amendment does what we need it to do and is indeed the appropriate level of protections in this instance. And I again encourage members not to vote for the amendment. Let's defeat the amendment, focus on the JFS language, which is what we came here to do today. Having said that, I very much respect the amendment and the intent of the proposal. I share everybody's concern. We want to make sure that we're doing the right thing. We're very confident without the amendment we are doing so. Are there any other comments or questions? If not, Madam Administrator, I, presuming we are going to do a roll call on this one. Please make sure that your faces are visible when you register your vote so we conform with the rules.
Representative Steinberg,
Representative Steinberg votes no.
Senator Anwar,
Senator Anwar votes no on the amendment. Thank you.
Senator Kushner,
Senator Kushner votes no.
Representative Gilchrist,
Representative Gilchrist votes no.
Senator Wong,
Senator Huang votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes on the amendment.
Representative Arnone,
Representative Arnone votes no.
Representative Berger-Givallo,
Representative Berger-Givallo votes no.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes no.
Representative Elliott, Representative Foster,
Rep. Foster votes no.
Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell, Representative Cabras-DeGraw,
Cabras-DeGraw votes no.
Representative Kennedy,
Kennedy votes yes.
Representative Claritas Detrier,
Representative Claritas Detrier votes yes on the amendment.
Representative Lenahan,
Representative Linehan votes no.
Representative McCarthy, Senator Moore,
Senator Moore votes no.
Representative Parker,
Representative Parker votes no.
Representative Ryan,
Representative Ryan votes no.
Representative Scanlon,
Representative Scanlon votes no.
Representative Terziak,
Representative Terziak votes no.
Representative Young,
Representative Young votes no.
Representative Zupkis,
Representative Zupkis votes yes.
Representative Django, Senator Haskell, Representative McCarty, Senator Haskell,
I'm sorry, Madam Clerk. Did you say my name again?
Senator Haskell,
Senator Haskell votes no.
Representative McCarty,
Thank you, Madam Clerk, and Representative McCarty votes no, excuse me. Yes, I'm so sorry. I just joined. Are we voting on the amendment?
yes, please.
Yes, so I do vote yes. Thank you, Madam Clerk, and excuse me.
Representative Django, ready when you are, Mr. Chair.
Madam Administrator, do we have a tally of the vote on the amendment?
Total voting 29, those voting yea 12, those voting nay 17.
Thank you, Madam Administrator. The amendment is defeated. We now return to the motion on the floor to approve the JFS language. Do we have further questions or comments? Representative Berger-Zavala.
Thank you. I just want to say one piece. We talk a lot, and it just happened again in the amendment, about the legal nuts and bolts of this. We talk about the implications of our votes on our constituents. We talk about all of that. But what I want everybody to think about before we take this final vote is about the actual people who have testified in favor of this bill. I often talk about advocates for bills who fight with all of their heart and soul, but they'll never reap the rewards of their work. They'll never see the benefit of the bill itself. They'll never experience that, and they fight anyway. And the people that we're talking about in this bill, they're not going to get to testify again for this bill because they'll be gone. For those among this group who feel compelled to mention that we've tried year after year to no avail to get this done, I wonder if you can remember the names and the faces of the people who stood before and begged for this law and then were absent the next year when it came up again. Sarah Myers testified twice in 2013 and 2014 until she died in 2015. Mike Mazzone, he died in 2019, not long after testifying here. This year, we who were here last year all noticed the deafening silence of Kim Hoffman's absence. And if you weren't listening last week, when Kira Phillips spoke, her mother Claire, who fought her terminal cancer for over 3 years, found herself without any hope, the kind of hope that this bill would have given her. And instead, she shot and killed herself 3 days before the end of our session last year. And I am very certain that you will all now recall the lovely Linda Bluestein, who spoke last week. I know that I am not likely to ever forget her, and she is not likely to testify next year. To the folks on this committee and in this legislature who oppose this, do you want to avoid voting on this bill? And do you truly comprehend the devastating impacts of your intransigence or your inaction? Real people from Connecticut need our help. We've heard from them. You or your loved ones could someday need this help, And it is so long past time that we in this legislature do the right thing here. And that's really all that I have to say, and I will be quiet now. Thank you all.
Thank you, Representative. I appreciate your sentiments. There are a lot of raw emotions related to even the prospect of ever having to avail oneself of this legislation. I'm sure none of us wish for ourselves, our families, or anybody we know the prospect of having to even contemplate such a choice, but we want to at least afford them that option. Senator Summers, followed by Representative Claridis DeTria.
Yes, thank you, Mr. Chair. I wanted to start my statements by saying that clearly the emotions are running high on this particular bill, that I do agree. This is a difficult decision for many of the people on this committee, which I think is why in other states that we've heard people refer to, Washington, and I think it is, Oregon and Washington, both states made the decision to send it as a referendum so every citizen had an opportunity to weigh in, and the merits of the bills and the process had a longer time to be debated amongst the citizens of those states. And the other state that passed, Vermont, that went through a legal overview through their judiciary committee. And some of our neighboring states like Massachusetts have had this on the referendum, and it has failed. But I do want to say that the hearings that we've heard for years now are always very emotional. It is impossible to not be impacted by some of the stories that we hear, and they're heartbreaking to hear in many cases. That being said, when we hear people saying that the legislature needs to do the right thing, I believe that there are people that have a difference of opinion on what that right thing is. Is it the right thing to pass a bill to help aid in ending life? Or is it the right thing to talk about the services and the care that we provide at the end of life? So I don't think either way how people vote on this is necessarily a right way or a wrong way. So I do take exception to some of those broad statements that if someone is not supportive of this bill, that they are not doing the right thing. And if they are supportive, that they are doing the right thing. So I wanted to say a couple other things. First of all, personally, I am not someone who has not been present during death of loved ones, who has not experienced some of the voids in hospice care, et cetera, at the end of life. And I do believe that those can be fixed. I believe that there is some inconsistency in this bill in the fact that even if you believe it's sound philosophically, I don't believe it's sound practically. And there are too many loopholes that are still available in opportunities for abuses. And we've seen those abuses in other countries. Just 2 minutes ago, this body was not willing to add original language for an added measure of safety to ensure that these deadly drugs that are cocktails that are off-label, they are not indicated for this use, would be made sure and clear within this legislation that someone abusing them would be considered a Class D felon. So I find that there are many loopholes that need to be tightened up. And I think that there are undeniable implications for vulnerable populations and for those with special needs to this bill. Undeniable. Every single national group that represents those with disabilities are against this bill. I think the focus should be on a clear foundation of improvement for the quality of hospice care and palliative care. Palliative care is the emotional and spiritual care for, excuse me, a person when a cure is not possible for their disease. It doesn't hasten or postpone death, and it provides and minimizes suffering at the end of life. We have an opportunity to focus there rather than creating a whole other system, which to me does not have adequate safeguards to protect life and protect the use of these dangerous drugs, again, off-label by FDA, to be used to end life. Another one of my concerns, which I think is very valid and needs attention, is that most doctors are not trained in palliative care. They are not trained in end-of-life options. And therefore, I think they should be required to have that type of training before they are allowed, should they choose, to participate in aid in dying, which I call assisted suicide. Other people do not. That's how I see it. Most don't have it, and therefore, if they don't have that kind of training, I don't think that they can properly provide alternatives for their patients. If they don't have the training, how do they provide those options for patients? And most MDs do not have the expertise or the specific training to make the decision whether someone is mentally, has the mental capacity to make this type of decision. And therefore, allowing a social worker to do that in this bill, to me, is reckless. That is something that is outside the scope of practice, and that should be addressed. I believe that there are opportunities to ensure some of the stories that we have heard are taken care of with a focus on end of life and palliative care and improving those. And that's something that in public health we should be committed to doing. I believe that the safeguards in this bill, especially with what we've just seen in the last 5 minutes, are hollow and need to be addressed. And in closing, I would say that it is so hard to do this, but it is really important that when we pass legislation, that we are doing it without basing it on emotions. And that's very hard to do in this circumstance, but that we are doing and creating policies that are sound for the citizens and provide the adequate safety net that people need in making these difficult decisions. And I wanted to make sure that I was able to say that before we take this vote on this bill. And if this bill passes today, which I am assuming it will out of this committee, I do not see any reason why it should not, if it's that great of a bill and written so well, it needs to have judiciary take a look at it, and maybe that will happen in the screening process, because there are things in this bill like the death certificate. We are redefining what suicide is, the definition. We are allowing someone to end their life by an overdose of drugs off-label, and we are putting on their death certificate that their death is from aid in dying. To me, that's semantics. The reason that they will be dying is from an overdose of drugs. And I think those things need to go through the legal process, or at least have our committee, our judiciary committee, look at that. I'm not sure what we are afraid of to not be able to send it there. So I will make that case in screening, should this come up on the agenda. But I wanted people to know I've thought long and hard about this. And I think that we can all conceptually understand what it may be like to be faced with these choices in a terminal disease ourselves or for our loved ones. And I understand that, but I think this bill is not the way to go about it. There's too many things in this bill that I think are wrong. I've heard from constituents that support it and other constituents that do not support it. And I think given a different perspective on what we can do to improve the end of life for some would be a better way to go. If you look at how other countries work in this area, it has been quite a slippery slope in places like Holland and Australia. But in those countries, you are not sending somebody home with a medication that does not have a chain of custody. It is controlled with a physician, with sometimes a nurse present. The patient is asked right before they take an injection if they still want to do this, not 6 months before. And I think that the general public has an idea and is supportive of this concept, but when you talk to them about what is in this bill, they change their mind. They have a difference of opinion. And so I think we need a lot more work here before we pass this. And I would urge those on the committee to think about that when you cast your vote today. I realize that a vote yes today at a committee does not mean that you will support this should it come to the floor. But I will be a no today on this bill. Thank you.
Thank you, Senator Summers, for your thoughtful remarks. You raised a number of interesting points. I'm just going to respond to a few of them. I want to start by saying that this bill by no means is intended to serve as a replacement or as a criticism of Connecticut's palliative and hospice care abilities. And I concur with the good senator that we should do everything within our power to strengthen and improve access to palliative and hospice care in the state. And indeed, if we can find ways to do that and encourage appropriations to fund that, we should be pursuing those things as well. And I also agree that we should do everything we can to make sure all providers have adequate training and sensitivity to these difficult issues and are very aware of many of these end-of-life predicaments, if you will, and are able to address the need of their patients in the broadest sense of what I view do no harm really means, which is to really make sure that they are not making their lives worse by continuing to provide treatment, which, as we know with our current medical technology, can prolong life virtually indefinitely, but may not be the desire or in the interest of the patient. I also want to comment on one of the points that Senator Summers made, that this is not a practical bill, and that what are we afraid of? Well, I'm going to turn that around and say, we have experience now in 9 other states, including an extended decade-long or more experience in Oregon. And with bills and laws considerably similar to ours, the outcomes, the fears of coercion, of misuse, of abuse, of malpractice have not been borne out. So I submit, what are we afraid of? We're following the same path the other states have. We have effectively similar language. The outcomes in the other states have not confirmed the worst fears that have been expressed here and expressed in testimony. That this is indeed almost certain to be a practical bill, even if it doesn't address, as no legislation does, every last contingency, every last potential thought about how somebody might misinterpret or abuse this law. It hasn't been borne out by any of the states, as far as I know. Comparisons to European laws with different cultures and entirely different legal systems is probably not necessarily the best comparison. And let me just conclude, because I see we have a number of questions and comments still to come here, that it's often true the government lags well behind the public sentiments of the people they represent. And this is a perfect case of that. A recently completed study of voters here in the state of Connecticut, recent, indicates 75% want this option. Not only that, despite what we heard in testimony, 65% of those with a disability want this option. 69% of Roman Catholics want this option. And this was after they had been advised as to the nature of the bill. This was not some, broadside of a barn. We made them aware of what the bill was about. So I believe that responds to your contention that they don't know what they're talking about and they don't want this. Au contraire, that this is the predominant sentiment of the people of the state of Connecticut. They want this option, whether they ever would find themselves in the situation to need to avail themselves of it or not. They want this option. And what I find most interesting is that 73% of people 50 and older who can probably see death somewhere in their future are in favor of this. But 80%, more than 73% of people 18 to 49 want this option. So this is not some sort of ageism thing either, where people approaching death are thinking about it. Even young people want to have this option on the table for themselves. I'll leave it at that. Representative Claire Teacher, followed by Representative Kennedy.
Thank you, Mr. Chair. And I'm not going to go through everything that Senator Summers had mentioned before, but a few points I have to make. We know this is it's a very emotional, it's a personal, it's a difficult issue. I've spoken to many of my friends, family members, constituents, and myself. I understand. I would like to be afforded this opportunity if my end of life decisions had come to something like this. But once I start to explain to them the concerns that myself and my fellow legislators have about this bill, they're like, oh, I didn't see that. I didn't understand that. Because on the surface, we all want that decision, excuse me, at the end of our life, to make that decision for how we want to end our life. And I understand that, I agree with it, and I respect it. But I just think there's certain things here that need a little bit changing before I think most of us can support it. But one of my other concerns is we talk about and I know many of us have because we've seen them on screen, our furry friends, our other family members. We afford them that decision and we make that for them at the end of their lives. But with that, I'm not comparing an animal's life to a human's life, but they're there with the doctor. They're there with the family. Everybody is there with them. The doctor does the injection. I don't know why we're not affording that same ability to us, why we don't have to be with a doctor or medical professional to inject us with this medication to make sure nothing happens, that there aren't any problems, that we're not suffering. I do that with my cat. I would want that same ability for myself. And I can't imagine that no one else feels that way. We also do, not in Connecticut, but when we do lethal injection, it's the same thing. The medical community is there, whether it's clinician or a doctor, whomever is there available, to make sure that people are comfortable and that nothing happens. It's rendered me speechless at times with this, but I think we need to also, and Chairman, you've mentioned that, we need to address our palliative care and our hospice care. And maybe something moving forward next year, we need to address the problems with those. How they vary. And we've heard story after story, we've all heard it year after year, the issues that people have had with hospice home care and our family members and our loved ones suffering. And I don't want to see that for anybody on any level, human or non-human. So with those, I just encourage a little bit more work, especially on the legal aspect, and just having medical professionals there for this bill. And hopefully at some point I can support this bill. But thank you, Mr. Chair.
Thank you, Representative. I'm not going to get into the pet analogy other than to note that the one key difference is that our pets lack agency, their ability to express their intentions, and we have to make those decisions for them. What we're talking about in this instance is granting agency and allowing the individual to determine how they want to go out. Ideally, they would choose to have their family around them. Maybe some wouldn't choose that, but it's giving them that choice. I think some of us would wish we could talk to our pets and figure out exactly what they're thinking, but it is slightly different. But thank you for your sentiment.
And I agree. And like I said, it's the medical professional part that's a big piece for me. Thank you.
Thank you. Representative Kennedy, followed by Representative Foster.
Thank you, Mr. Chairman. And I don't know about you, but I talk to my cats all the time. So, Mr. Chairman, this is incredibly emotional. And I wasn't going to speak, but I had to because of some of the comments that were made. This is not about parties, political parties, affiliation, whatever you want to call it. This is about people, and people who unfortunately are afflicted in their whatever time of their year with a deadly disease, whether it be ALS or cancer. And we heard so much emotional, heart-wrenching, compassionate testimony, very compelling. From one of the towns I represent, we heard from 7 different people that were afflicted with ALS. And for anyone that's ever watched anyone with ALS, it's wretched. It's wretched to watch someone. So I just wanted to say that, but we need to keep in mind to not go I don't, I'm not even sure how to say this anymore. I don't want to go on the attack of each other. This is about someone else's decision and how they decide they're going to end their life. For me, for a dear friend of mine who did suffer from ALS and had the retinopathy machine just a couple of days before he died, and blinked to me, I should have killed myself when I had the opportunity. Not everyone's like that. I get that. But the thing with this bill that not bothers me, but we do need to look at palliative care a little bit more. And once we get past this part of the bill, I hope that we will do that. It's such an important piece, as is hospice. I know I've stated it before. I was a volunteer at hospice for 3 years as a patient care assist. I cannot tell you how many people whose hand I would hold and rub their forehead at the very last minutes of their lives. So it can be a dignified death. And I think at right this point, I am babbling and I do apologize, but just let's not get at each other's throats. It's a difficult bill. I wish the safety measures had been put in. They weren't, but let's just go forward with a little bit of respect for each other. Thank you, Mr. Chairman.
Thank you, Representative, for those sentiments. And I really hope that this is not a partisan issue, and we'll have to wait until the vote to see that. But it's certainly not the intention to declare that there's necessarily a right or a wrong answer. If anybody expressed right, I think it may be reflective of the public sentiment. But I also want to thank you, Representative, because you seem to be a little voice challenged. You really had a work that we appreciate that you cared enough to put your voice at risk, because it was. We appreciate those sentiments. Representative Foster, followed by Representative Carpino.
I'm sorry to follow Rep. Kennedy. Your comments were very moving to me, and I just want to share one perspective in this conversation, because in the debate we've been talking a lot about off-label use and that being a specific concern. But I just want to specify that off-label uses of medications are really common. In fact, my daughter's life was saved by an off-label medication use because it allowed me to stave off preterm labor long enough for steroids to mature her lungs to sufficiency. And in a publication in 2009 in the Journal of Healthcare Reform, in a study of 160 common drugs, 21% of prescriptions were for off-label use. And so I've been listening to this debate with rapt attention, and I hear both sides, and I think I'm hearing from my constituents a lot of perspectives from folks on both sides. But I just want to make sure, as we have conversations about the merits of the bill in and of itself, that as we venture into medical practice, that's with the exception of 2 members of this committee, outside of most of our scope. And since off-label use of medications is commonly used, and in occasions like what I've experienced, life-saving, or in the occasion of having congestive heart failure and being prescribed a beta blocker, which is a really common practice, it can be life-saving. So I look forward to listening to my colleagues continue. I've really appreciated the candor in which we've all relayed our personal experiences that have been really emotional around this. And I will just finish by saying that at the end of session last year, I had a constituent whose mother passed, and it was one of the most upsetting phone calls I've ever gotten as a state rep, as he called me and told me he wanted this option for his mom, and he was navigating trying to advocate for this on her behalf, and was disappointed to see that it was voted out of committee and never voted for on the floor, because his mom was suffering and begging for him to offer her relief. And when he called me afterwards to let me know that she had ultimately passed, he still told me he was very passionate about ensuring that this was an option. And I know we all listened to that public hearing, and it's been really heavy and emotional and weighing heavily upon us. But I just feel really strongly that as we debate this bill that has so much feeling behind it, we focus on the facts and actuality. And I think off-label as a concern, since it's a very common medical practice, is probably not as strong of an argument as it's presented as, since it's so common. But I really respect and appreciate all of my colleagues, and thank you so much for the time to speak, Mr. Chairman.
Thank you, Representative. Representative Carpino, followed by Representative Zupkis.
Thank you, Mr. Chairman. Just a few comments, if I may. I have to tell you, sir, that it takes a rare bill to know that I'm going to upset both sides with my vote. Usually it's one side or the other, and I'm convinced that this is the bill that will upset absolutely everybody. And I have a number of issues with the language, and based on our online format, I think they're better addressed by amendments on the floor. But my one real concern today, and that unfortunately it will force me to vote no, is the lack of having a medical provider at that bedside, in that living room, in a hospital if a family so chooses. And I cannot overcome that. I was in a similar place when we debated this hearing committee last year, and sadly that has not changed. The testimony we heard last Friday and Saturday and in years past is all very moving. And I'm sure every one of us has sat with a family member or a friend or a loved one. Death is hard. Death is scary. And regardless of the method, this doesn't change that. I understand it may give an individual control. And I said it here publicly, and I'll say it again. This is an option that I wish I would have if I were in this situation. And I think some of my family members would as well. But the lack of a medical provider with that family member during such a difficult and emotional and scary point in your life is just a hurdle I can't overcome. And to everybody on this committee, I respect your decision. This is not a partisan vote. This is not something that is easy for me, and I suspect not easy for many of you. But I do hope that folks realize that we've all been touched by the folks that came before us. So I respect everybody who shared their stories. And I wish I could vote for this. Hence, everybody's going to be upset with my vote now. But the fact that if somebody could be ending their life alone with medications that a physician merely wrote a script for and intentionally doing so is not something I can overcome, sir. I know how important this is to you, and I respect that. But I would feel like I was letting down folks who are in very vulnerable positions if I let the vote go forward with a yes based on the language I have today. But I thank you for your time.
Thank you, Representative. And I respect your position, in particular the way that you phrased it so eloquently. I'm sure it's probably not much by way of consolation other than to say that as we look at the process that we put into this language, it requires the involvement of not one, but two practitioners, and that there are more than ample opportunities to have the conversations that you're talking about. And nothing precludes a provider from being present. I would again direct you to the experience of other states whereby without such a requirement, there have not been the untoward outcomes that you described. So I'm hopeful that even with the absence of a provider at that very moment, that their engagement is such that it involves those kind of protections. And I will just add that under the current circumstances, many people die at end of life alone, but also in great pain. And we're trying to alleviate that. So by no means is this a guarantee that people will be surrounded by their loved ones or friends. This is just an effort to allow them to order their lives in that fashion that might actually promote that prospect. Representative Zupkis, followed by Representative Gilchrist.
Thank you, Mr. Chair. And as everyone has said, this is not easy. And I too probably, God forbid, if I was at that point in my life, I would probably want to consider this. And I cannot say it as eloquently as Representative Carpino said, and that's my stumbling block. I don't understand how in this language we could have not put that in there. I think that is something that is needed. And I think that the other piece is that it should go to the Judiciary Committee, as we talked about before, because there are pieces in here that are well beyond the Public Health Committee that should be discussed in the Judiciary Committee. A question I have, Mr. Chair, is what is the delivery system for this?
I'm not an expert on it. I understand that typically it involves 4 medications which take you in the combination, virtually assure a quick and timely demise. The administration, I understand, is often delivered in the form of, excuse the phrase, a cocktail. It's often used. We're talking about a combination of drugs, which effectively renders it as a somewhat viscous slurry, which can be ingested, I imagine, in a drink glass or something along those lines. That kind of represents the limits of my knowledge, other than to say this has been going on, from what I understand, pretty smoothly in other states.
So we really don't know the delivery system then, as what I'm hearing from you is we're not sure what the delivery system is.
I'm not sure I understand your question, Representative.
Well, because I am curious. I'm curious as to what it is, and I would prefer it to be very specific as to what it is from a doctor. We know that people have a hard time swallowing pills. We know that, there's all kinds of issues with these things, and we're talking about something that is deadly and something that is going to kill someone. And so not only having the physician there, I would like to really know what the delivery system is. And is it the same for everybody? Is this a one cocktail, so to speak, and this is what it's made of? That's a question I have. My other question, just out of curiosity, is this covered by insurance? How is that handled?
Thank you for the questions. I am not an expert on insurance. Some of the concerns that have been expressed over many of the past years with regard to insurance coverage do not seem to have obtained in other states where there's some concern that it would that the person's death would not be covered under normal circumstances. But when you ask whether it's covered by insurance, you're talking about the medication being covered by the insurance? I'm not clear what you're asking.
Well, is that covered? What if, God forbid, something goes wrong, and then what happens to the person and they're back in the hospital or any of those things? Our medical, people have insurance and some people don't. And if this is something that for anyone to partake in, if it's not covered insurance, is it $10,000? Or is it $200? Is it, I think when we're looking at medical practices, that enters into the insurance realm and what is covered and what is not. Is it covered under Husky? If it had, those are just some of the questions that I have, is how does it play into the insurance realm of it? Because like I said, some people have insurance and some people don't. And if this is for everybody, what does that look like? So I think maybe there's a whole insurance aspect to this that should go before the insurance committee possibly as well.
Well, I would venture to guess it's probably not covered by Medicaid, but I understand that it is covered by some private insurance. I also see, as we often see with insurance, that coverage changes as medical knowledge goes forward. I can only bring you back to what gives me confidence that we've done this the right way. We're emulating legislation from other states which have passed this law and have not had the untoward outcomes that are the expressed concerns and fears would lead us to believe are possible. If we were the first ones out of the gate with this, I would be as concerned as you that we don't have all the answers. And we'll never have all the answers. But the fact of the matter is, we have a long history in one state. We have the history in states that are very diverse and different than our own state. And the concerns expressed simply have not transpired. There have not been widespread insurance issues that I'm aware of, and there certainly haven't been, any real documentation of problematic outcomes. So that's what I'm going on.
So is this in other states, since the research has been done by the proponents of this bill? Is it covered under insurance in other states?
I'm not expert other than to say that in some ways, federal law would not allow coverage in every instance. So by definition, I can't give you a categorical answer. However, there must be instances, to your point, where it is not covered.
Well, thank you. And I know we talk about the other states, but I do believe they've done it a little differently through the process of referendums and judiciary and all of those things. So it may be somewhat a mirror, but it's not exactly. And we've pulled those things out, which was in the bill that's been in the past. I don't even know how many years we've been talking about it, but thank you, Mr. Chair.
Well, thank you, Representative. And you remind me of a mistake on my part when Senator Summers brought this up in the first place with reference to a referendum. I understand that in 2010, the Connecticut Supreme Court ruled that this kind of legislation could not be brought forward as a referendum in the state of Connecticut because of our laws. So we are following the appropriate path. Representative Gilchrist, followed by Representative Pettit.
Thank you, Mr. Chair. This is not a hard vote for me. Throughout my life, I've had conversations with friends and family about end-of-life decisions. But what really solidified it for me are the strong measures that are in place in this bill. The fact that someone must be terminally ill as determined by an attending physician with 6 months to live. The fact that it requires 2 witnesses for an aid in dying request to be valid. The fact that it allows only patients themselves and not anyone else acting on their behalf to request aid in dying, and many more. There are measures in this bill that I think are incredibly strong to protect from abuse. We heard over and over this year at the public hearing and last year, and many of us have known people who love life, but have unfortunately gotten a terminal illness and want to have this decision. And to me, the beauty of this bill is that if you don't believe in aid in dying, or this is a decision you wouldn't make, you don't have to. This bill is not saying you must choose this decision. It's just giving individuals an additional option when they have been diagnosed with a terminal illness with 6 months to live. We heard that we have failed people who wanted this decision and have passed away, and I don't want to continue to fail people in the state of Connecticut, and so I will be voting yes today. Thank you, Mr. Chair.
Thank you, Representative. Representative Pettit, followed by Senator Anwar.
Thank you, Mr. Chairman. Senator Summers did a good job of really enumerating many of the points that I would make over our last 5-6 years of discussion. And like many of the other speakers, it's a difficult issue. I don't think anyone who's voting yes on the bill or no on the bill wants anyone to suffer. It's the mechanism. There are people who remain, from a religious point of view and philosophical point of view, opposed to the concept, regardless of how many safeguards are in the bill. Just don't think that it's appropriate based on their religious values and beliefs. There's many physicians who want to care for patients, who want to care for them to the end of time, and want them to be as free as possible of suffering. That is not always completely possible with what we have at our disposal. And many physicians don't want to be responsible for writing or handing basically a deadly cocktail group of medications to someone to, if you will, actively take their own life. So I think it's a difficult vote for many. It's a difficult vote for me, Mr. Chairman. As you know, we both talk both from a religious, philosophical, and medical point of view. Representative Gilchrist makes the good point that it's elective for people. But it also creates a societal value, if you will, takes that step over the edge where we're allowing people to kill themselves. And I realize there's a semantic issue and people on the S side will be upset. The issue of suicide, but I mean, suicide is essentially taking one's life, and many people just don't believe that is appropriate, again, from a religious and philosophical point of view, and they don't want society to go that way, especially at a time when we're having record highs in suicides for other reasons. I realize not directly related to this topic, but I think many people feel it sends the wrong message, if you will. And I know that can be argued, and many people argued that during the public hearing. I heard their comments. But as some other people have discussed, I think most people, like many of the bills we deal with, know sort of the general concept, know the 1 or 2 sentence description, but know the details. They may have had a family member, so the small percentage of people may have been involved in this process and may know more details because they've had personal experience, but I think many people do not. So I think it's a difficult issue. I don't think it's something we should proceed with, and thus I'll be a no. To the points of the legal issues, I think there remain legal issues, and I hear your point that this has occurred in a number of other states, and they haven't seemed to run into those issues. Again, I note that I believe Vermont, I think, ran it through their judiciary. Still think that's appropriate, but I thank everybody for their measured remarks and the ability to discuss this. Thank you, Mr. Chair.
Thank you, Representative, and I want to thank you particularly for the long conversations you and I have had about both the practical and the philosophical considerations involved here. We very much appreciate everybody's wrestling with this very difficult decision. Senator Anwar, followed by Representative McCarty.
Thank you, Mr. Chair. I truly appreciate our committee. During the public hearing, almost everyone took all the time to listen in and digest all the emotional conversations. And we may have approached it from all different angles based on our experiences. And we may have come to conclusions which may or may not agree with what this bill is asking for and requesting. I'll share, and I'll put it in and frame it in a different perspective, hopefully. And this perspective may not be new to individuals, but look, as a physician and as a person who's in the intensive care unit, all of us as humans are hardwired to protect others. We are hardwired to protect our fellow beings. That's how we are made. That's how we are supposed to be. And when you're in the medical field, that hardwiring is strengthened every single day to try and do each and every possible thing to try and protect individuals, patients, community, and do whatever you can to help out. But the reality is that science can go only so far, and then people are going to die. And when they die, some of the deaths are very ugly. And the way I look at this is that all of us are going through a journey of experiences. And in this journey of experiences, if you would ask me about this bill about 5-6 years ago, I would probably not even have a conversation with you about this bill, because I'm hardwired to protect life. I'm up at night in the middle of the night, more nights than I would let people recognize, trying to do everything to see how we can save somebody's life. And even if it gives them a few more days of quality of life. But in this journey, you see how death can be ugly in some people. And I'm using words with, there are ways people die which keep you up at night. The ways that people's loved ones may die, that is going to keep them up for the rest of their lives, that painful process. And that is not in our control if we don't try to recognize, identify it, and have prevention strategies to make sure that the person doesn't suffer through the process. Look, again, what I was also suggesting in the public hearing was that it does not have to be a binary thing. It's hospice and palliative versus this. It has never been in fight with each other. Hospice palliative are a way of moving for the patient's journey in that process. But the last days, the last moments, there's an anxiety because frankly, nobody has ever been able to come back and tell you that, look, this is what the process is and this is what you do to make it less painful. We don't know. Nobody knows. But we know that there's fear associated with it. There's anxiety associated with it. And that is our human vulnerability. So, and the data points out as well that a significantly large population of people who have this conversation with their doctors in the states where it is allowed, they would actually not fill the prescription. And even if they fill the prescription, they don't use it because this is a lack of a better word to use. This is a life insurance against their death insurance, if you will, where they know they're going to die, but they want that insurance that if it comes to that painful moment, I have an option. And then they continue to live their life as much as they can, continue to get the treatments that they want. And that is something that they are asking for and looking for. It is a small group of patients. If you look at the data in the other states, it's a small group of patients. And the way I see this is that small group of patients, they need this. And what all of us believe, what I believe, and what I would choose for myself as a doctor or as an individual is not as much relevant to their rights. And none of the other states require a doctor to stand next to them all night to be able to do this. We have experience. Thankfully, we're not the first one to do this. And we have actually evolved in the journey of this bill in different states to know what is the best way to do it. So the how is the bigger question in some minds, and why is another big question. And then the why takes a journey, but how has been well worked. And it is very well worked out and it works very well for people who have required it, but it's a small group of people. And that's why we have a responsibility to make sure that we don't impose our religious value-based beliefs onto others. We can live it on our own, but we don't have to put it onto others. That's where I'll stop, and I will look forward to voting and having more conversations with my colleagues, and hope and pray that each and every one of our loved ones never have to leave the planet ever in a painful way. And then that's something that we will all agree on. Thank you so much.
Thank you, Senator. Before I turn it over to Representative McCarty, I just want to respond. I got some additional information with regard to Representative Zupkis's question with regard to insurance. As it turns out, 3 states have allowed Medicaid to cover aid in dying medication. So it's quite possible Connecticut could choose to do so. Obviously, we haven't done it because there's no such law enabling it to that effect. And given the relatively small number of people who would even apply or be eligible, I could hardly imagine that it would be have any significant impact on premiums. We're talking about hundreds of people. And there's something to what Representative Zupkis says to make sure this is as equitable as possible, that people of all income levels have access. So Representative Zupkis, if you'd like to work on, if this bill passes, work on making sure that Connecticut Medicaid covers it under Husky, I would work with you on that.
Thank you, Mr. Chair.
Representative McCarty.
Thank you very much, Mr. Chair. And I apologize to the committee running back and forth between hearings today, but I feel compelled that I must say something about this legislation. For me, this is absolutely the hardest decision that I have been presented with since being in the legislature. And I would like everyone to know that naturally we all care, and we all care about everyone at end of life. And that, I think, should go without question. So I do take some exception when we hear comments that we're transient and that inactive on this. We have some legitimate concerns about the bill in front of us. And as legislator, we have to look to do our very best to have a bill and a piece of legislation going forward that is without flaws. So I will comment that the dispensing of the medication has a concern of mine. In section 9, we reference another agent. I'm not quite sure who that agent might or might not be. Also, that's in the dispensing piece of the medication, but we also have I have concerns on the disposal of the medications still. So I think those are actually valid concerns that we could have, trying to make this the best law possible. I know a lot of progress has been made in the past. I also do have concerns about listening to our disability rights advocates, and those concerns are upsetting to me still as we continue to look at this proposal. I would like the committee to know that I worked very long and hard to be with both of my parents at their last moments of life. My father had ALS, so I certainly know what it means to be with someone. And we appreciated the time together, but this legislation does not protect some of those individuals. At the end of life, they're not able to swallow. For one, ALS hits, it's a motor neuron disease. The limbs are not flexible, so someone wouldn't be able to pick up their hand to even take the medication. Those are some other concerns that I'm not sure we fully discussed, but there are a lot of people that are left out of this legislation as well. And I too put my remarks with Senator Summers. I wish we could do more with hospice and palliative care. We recognize some of the flaws there, that we could maybe look at those regulations and help people more at their end of life. So I think there's room that we have not looked at. But basically, I think the timing is still a little premature on this legislation. I'd like to be able to fix those flaws, the death certificate piece, the judiciary, why it can't go to judiciary for review. Those are some legitimate concerns. So I'm very torn on this legislation. I don't want anyone to suffer. I'd like to put that out there. We all care about end of life. So I'm in conflict, basically. Thank you very much, Mr. Chairman.
Thank you, Representative. Yeah, we all care. It's one reason I love this committee. Everybody is very thoughtful, displays tremendous compassion and thoughtfulness about very difficult issues. There's just nothing more difficult than life and death. And I respect everybody's point of view and the difficulty of their decision. All I can say is we're granting enabling choice for a very small group of people to make their decision based upon their circumstances, their information. I can't put myself in their bodies. I can't tell you what is intolerable pain or diminishment of life to the point where they would even contemplate such an option. I hope I don't ever have to be able to fully appreciate that. It's hard for us to legislate on behalf of others. We are not telling them what to do. We're telling them that they're allowed to do something that they may choose to do. Representative Cook.
Thank you, Mr. Chairman. And Mr. Chairman, I think that it might be you and me and a couple of others that have heard this every year for the last, I don't know how many years. And it is sad to see the amount of people that have once testified in front of us that are no longer with us, and that we rely on their loved ones to come back and testify about how important this was to them, and then we failed them. On the other hand, we also have a group of people that do not believe that this is the right decision, whether that's personal, religious, or otherwise. When I took this office, I took it with the promise that I would check my own personal opinions at the door, and that I was here to represent the people that put me here, not represent my views, but theirs. And I find that when we do that, that makes us much better legislators. And I work with a group of incredible legislators on both sides of the aisle. I think the one thing we have to remember is not every community is the same. Not everybody believes the same. And as I shared with everybody last year, because I have been a no vote on this bill since the beginning until last year. And last year came on the heels of my stepmom the year prior losing her battle with lung cancer. And recognizing that on her nightstand every day for a month and a half was enough prescribed morphine that she could have took her life at any given moment. And contrary to what anybody wants to say or agree to or not agree to, when I had my mother-in-law in hospice in a Catholic hospital, mind you, The nurse said, here's the button. You can give her the morphine as she needs it. That is a lot to put on somebody. That is a very difficult conversation to have when you have somebody that you love laying in a bed that can't make decisions for themselves. We're talking about people that can make a decision for themselves. When my stepmom laid in a hospital and begged the doctor to end the pain, is just not a humane way to go. We treat our animals often better than we treat our humans. And there's hospice for my dog. And when my dog passed away, the vet came in, they gave him the medication. It was soothing, it was calming. They took, the dog out, and I didn't have to deal with all of that hurt. We as humans deal with all of that hurt when our loved ones pass away. It is often selfish. It is often the loss, the absence, the emptiness in our hearts. But there's also the guilt that maybe you didn't do enough. Maybe we weren't able to help somebody end the pain. Or maybe they didn't have the ability to end the pain. I don't ever want to see the look on anybody else's eyes that I saw in my mother-in-law's or my stepmom's eyes when she was laying in the hospital. She was diagnosed in February, died in August. And that is a quick and painful death. And then we see all the people that we've lost over the last 2 years. Some very painful. I don't believe that I was put here to play God. I don't believe that I was put here to make a decision on anyone's life. And I believe that these decisions belong at somebody else's kitchen table. That it is not my place to tell them what they can or cannot do. I am a born and raised Southern Baptist girl. And if we're basing it on the religion, everything that I know says this is not what it should be. But I want to say it again. It's not about me. It's not about my personal views, because those I check at the door. It is about the people that reach out and tell you those horrible stories. It is about the person that has to have their best friend truck them in the middle of the woods, say, please leave, shoot themselves in the head, and then in 20 minutes, call the cops, but then the best friend goes to jail. We are better than that. We are a much more humane, compassionate group than that. So I don't like everything in this piece of legislation. You already know that. We've had conversations about this. But I am not willing to stop the conversation here. I would like to see some more changes done. I would like to see some things fixed. So for that, I will support today. Doesn't mean that I can support later. But it is about the fact that I want more constituents to have the opportunity to reach out and tell me how they truly feel. Because that is why I'm here, is to support and represent them, and to ensure that nobody goes through the pain and suffering if they choose not to go through the pain and suffering. Thank you, Mr. Chairman.
Thank you, Representative, for that. I think we all naturally fear the moment it comes when we know that our loved one is certain to die. And I think it's quite natural, human nature even, for us to feel guilty, even with an unfocused guilt, wondering if we've done everything we possibly can for them. So, the person we remember is honored in that instant. And I guess all I can say is the best thing we can do, because this doesn't apply to everybody. In other cases, you better have your most orders, your directives, your do not resuscitates lined up, because this isn't for everybody. But the best we can hope for is to invest that choice in the individual themselves, so that we can be sure that we're honoring exactly the way that they want to go out. So I take your point, Representative Cook. Incredibly wrenching decision for everybody, and no bill is perfect, but our intent is to make sure we're protecting everybody involved in this process. Senator Moore.
Thank you. I've been very silent on this subject, although I have my own beliefs on what I need to be able to do, and I am supporting the bill. But I want to say for over 20 years, I did breast cancer education and worked with survivors throughout the state of Connecticut. And there wasn't a year that went by that I didn't have to sit at the side of a woman who was suffering from metastatic breast cancer and who suffered so much to watch them to the point where they couldn't even handle the medicines, didn't want the medicines, and watch them become so frail and lifeless and not have a place to go. I want to be honest and tell you, in my whole 20 years, I've only had one person who asked me, could I help them? But just that one person who did die after many treatments and many trials, died, but suffered so much along the way as she went through this. I think it's up to an individual. I think it's up to the family to make that decision along with them when they're in another place. I don't think that suicide should be the answer for these people who are suffering. And I really appreciate the comments of Representative Cook and what she said, because none of these bills are perfect, but there are opportunities. And I hear the argument about it going to judicial. If it goes through Senate screening, the attorneys will send it to where it needs to go. And if there's an amendment, that amendment can be made on the floor, and you could have a larger group of people voting on it. So that it's not the end of it, but I think Linda Blumenstein is actually my constituent, and she's one of the people that I first met when she was diagnosed with breast cancer. When she was diagnosed with breast cancer, she's fought for this a very long time, but her husband had met, and when I first met him 8 years ago, or maybe 10 years ago, had asked me, would I support this bill? And I've watched it happen over the years. I gave them my commitment. And as I watched Linda fight and do everything that she can while she's here, I owe it to her to keep my word. And to all those other women that I know have suffered so much from breast cancer, metastatic breast cancer, and had no place else to go but wanted to end it because the pain was so bad. I owe it to them to support them. But I will listen along the way about amendments and consider them, but I fully support the bill. Thank you.
Thank you, Senator. Are there other questions or comments?
Mr. Chair.
Representative Dauphiné.
For some reason, I'm having trouble with my hand, so I haven't been able to raise my hand, but I thank you just for a few moments to just make a few comments. And, you know, while I'm someone who always supports medical freedom and those choices, I think that Senator Summers did a really good job of highlighting so many of the concerns with this bill. And while I know some of those have been addressed, there's still many that haven't. And that's the big concern I have. I think many pointed those out. I believe that we can thoughtfully take the time to address those concerns and still have the outcome that everybody wants. And I just wanted to comment that using medicines off-label is technically not a legal practice of prescribing medicine. And I think it was Representative Foster mentioned it earlier. And while we know it exists, it's really not technically a legal practice of prescribing medications. And for that, I mean, I will be a no on this bill, but thank you for the time. I appreciate it.
Thank you, Representative. Representative Kushner.
Thank you, Representative Steinberg, Mr. Chair. Actually, you're the second person today who's referred to me as Representative Kushner, so I wonder if this is a trend.
My apologies. We hope you take it as a compliment.
I think it's wonderful to be an elected official in either chamber, so I don't see it as anything but a simple designation. So thank you for the time. I haven't said much on this. I listened closely to the public hearings, not just this year, but in previous years as well. I really appreciate what Senator Moore said, and it prompted me to speak up. This is something that's also such a personal issue, and I think we've all had different experiences. I come from a family that have really forever believed, for as long as I can remember, have believed that this should be a personal choice and people should have this option. So I grew up in that environment and have always been inclined towards supporting aid in dying. And, I will be voting for that today. But I do want to say I've had two recent experiences, one with my father who suffered from lung cancer. And fortunately, his end was quick, but it was aided completely by morphine. And he would not have, we were fortunate. It was literally 4 or 5 days that he was on morphine. I can't even imagine what Representative Cook spoke about, because our family was totally surrounding my father for that entire period. And I can't imagine how hard it would have been if it had gone on much longer. And so I feel like, that really, we have personal experiences that bring us to this place where we have to take a vote. And I really appreciate what everyone has said on the subject. But my personal values and what I think the people in my district want is to have these kinds of choices. So I will be voting yes today.
Thank you, Senator Kushner. And now I can practice my recognizing titles by saying Senator Haskell.
Thank you so much, Mr. Chair. So much has been said today by those who oppose the legislation and those who will be supporting it today. I just wanted to very briefly, perhaps some of the folks who participated in that public hearing are watching, and I wanted to acknowledge their incredible bravery and courage and empathy in sharing their stories with all of us, because I know that when I came to the legislature, I walked into the building without strongly developed opinions, without really ever having thought about the question of whether or not the state should permit these sort of very personal medical decisions. And I just want to say that it is because of the incredible testimony at the public hearing, the very moving stories that were shared with our committee, that I believe so deeply that this legislation not only needs to pass, but needs to pass urgently for those who are suffering from a terminal diagnosis and don't want to have to leave their homes and leave their families in those final weeks and days. All that to say, I'll be voting yes today. And in case there's anybody from that public hearing who has decided to watch this committee meeting, I want to let them know that their voice has mattered tremendously in this conversation for me, and I'm sure for many of my colleagues as well. So thank you.
Thank you for saying so, Senator. It's a challenge for us. Oftentimes, not just the mere length of some of our hearings, which are long, but also the nature of the testimony itself, not to be affected by it. I want to use this moment to reiterate Senator Haskell's point that we do listen carefully to all testimony as it's provided, because we can always be better informed, more nuanced in our opinions, and most importantly, inform the specific language that we use to pass legislation. So Senator Haskell is referring to people who are, to whatever degree, counting on us to either help them or help the next person, or to honor the wishes of somebody who would have availed themselves of it. We have very much heard you. We struggle sometimes to turn these desires, these wishes for better outcomes into law, but that is indeed our intent today. Senator, now I'm going the other way. Representative Berger Travala.
It's usually the last name that stumps people, not the first part. I just wanted to go on record with a correction on the off-label prescription. It is perfectly legal, very common, and more than 1 in 5 outpatient prescriptions written in the US are for off-label therapies, and that does come from the FDA. So that's all I wanted to say. Thank you very much, Mr. Chair.
Thank you. I guess the point is simply that not necessarily the prime way of doing business for medicine, but drugs are frequently used off-label and often lead to new indications for these drugs. One of the miracles of medicine is sometimes we develop a drug for one purpose and discover it's far more effective for some other purpose. Now, this is an extreme example and not necessarily a perfect analogy, but it does describe current practice with off-label drugs. Are there any other questions or comments? This has been a tough conversation, as it's been in past years. I want to just express on behalf of the chairs, we appreciate all of your consideration and patience and desire to express where you're coming from. This is not a right or wrong vote. This is trying to do as well as we can for very difficult, limited circumstances. So let me just make clear how much we appreciate everybody's contributions today. If there are no further comments or questions, I believe, Madam Administrator, that we're ready for a vote, which we will take by roll. Make yourselves ready for that. Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong.
Senator Huang votes yes.
I did not see you on screen, Senator, please.
Senator Huang votes yes.
Thank you. Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Betts,
Representative Betts says no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django, Representative Green,
Rep. Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Cabras de Gras,
Cabras de Gras is parked and votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Detrier,
Representative Claire DeStitria votes no.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarty,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
thank you.
In that not everybody was able to attend this meeting, we will keep the votes open till 3 p.m. We are back in the saddle on Monday for a public hearing at 9 o'clock. We'll be entertaining a good number of bills. I want to thank everybody for their good work today, as difficult as it might be. And I wish everyone a great weekend. We should take advantage of our weekends to rest up for the work yet ahead of us. And we stand in recess.
Madam Administrator? Madam Administrator?
Hi, Representative Jenga. I can record your vote.
Was my vote recorded before?
It was not.
Okay, I had just turned on my phone a couple of votes before. I did announce it, but I guess it wasn't accepted. I vote no.
Okay, gotcha.
Thank you. I assume that's the only vote that was taken today?
There was the amendment earlier proposed by Senator Summers.
But basically on this bill?
Yes. This bill
Okay.
is the only bill.
Thank you. See, I'm going to CVS. Two places to go. Where
Hello, is the meeting over?
Hello, Representative Ryan. The meeting is currently recessed. You can still record your vote if you'd like to.
Yeah, it's a yes.
Okay, on SB 88?
Yes.
Wonderful. Thank you.
Thank you.
Hey, Dave, are you on right now?
Yes, I am.
Great. If Representative Scanlon steps up, if you could get his vote in the next minute or so, I just got to step away for a second.
Sure. Got it.
I need you guys to
I am back. Hi, Representative Scanlon. How are
Hey,
you?
Dallas, how are you?
Pretty good.
I vote yes.
Great. On SB 88?
SB 88, yep.
Okay. Thank you so much.
All right, thank you.